Welcome back guys. Now let's discuss about the differences between upper motor neuron lesion versus the lower motor neuron lesion. See, try to understand. Upper motor neuron lesion means upper motor neuron is damaged. Now you think what might be the reason for upper motor neuron to be damaged? Maybe the person is having stroke, any problem to the cortex. So if the person is having stroke, then the upper motor neurons are going to be lost. So now you tell me what happens if the upper motor neurons are dead. Try to understand it guys. These upper motor neurons are like parents. Okay, the upper motor neurons are like parents. The upper motor neurons control the activity of the lower motor neurons. Lower motor neurons are like more notorious children. Upper motor neurons will regulate the activity of what? Lower motor neurons. So upper motor neuron will tell to the lower motor neuron when to fire, when not to fire, how much to cause the muscle contraction. It's all controlled by the upper motor neurons. Today, what happened? Today, upper motor neuron is dead. Okay, today upper motor neuron gone. When the upper motor neuron is gone, this lower motor neuron, there is no control over it. So it's going to do all kind of notorious things. Okay, now this lower motor neuron will fire unnecessarily. It will cause unnecessary muscle contraction, too much muscle contraction. So the person is going to have the contracted muscles. So he cannot use his muscles now. He cannot do movements, any movement. So that's going to cause a spastic type of paralysis. The muscles are into spasm. So that's going to cause a spastic paralysis. Okay. So right, what type of paralysis will be seen in a patient with upper motor neuron lesion? There is going to be spastic type of paralysis. Now, if you do any reflexes, if you check for any reflex, okay, like knee jerk reflex, elbow reflex, how the reflexes are going to be. Try to understand. Look at this diagram. See, here we are going to discuss about the reflexes. In few minutes, I will discuss about the reflexes. See, in a reflex arc or in any reflex, it is the lower motor neuron. See, it's the lower motor neuron coming from the spinal cord. You know, this is the lower motor neuron. This yellow color thing is the lower motor neuron. It's the lower motor neurons which are helping in the reflexes. But today, what happened to the upper motor neuron? Upper motor neuron is dead. There is no more upper motor neuron. So now what happens to this lower motor neuron? Lower motor neurons are doing the overaction. They are unnecessarily contracting the muscles. Okay, they are firing too much. So how the reflexes will be? There will be too much reflexes. Because in reflexes, it's not the upper motor neuron, it is the lower motor neuron which is involved. So whenever the upper motor neuron is gone, the lower motor neuron will unnecessarily fire, it will overfire and will exaggerate the reflexes. So there is going to be hyperreflexias. Okay, so right. In a patient with upper motor neuron lesion, there will be hyperreflexia. Okay, hyperreflexia. And what about the muscle tone? If you check the muscle tone, okay, first of all, you have to know what is the meaning of the word tone. Tone means resistance against passive stretch. Resistance against passive stretch is called as tone. Now, whenever you come, okay, you are coming, I am not doing anything voluntarily, you are coming and you are trying to stretch my muscles, let's say, you are doing like this, you are extending like this, okay, or you are flexing like this. See, my muscles are going to offer some degree of resistance because in a living person, always the muscles are contracted in a certain degree. The flexors and extensors, they will be contracted. So, when you are trying to perform a movement, the antagonistic muscles will show a certain degree of resistance, definitely. So that resistance offered by the muscles against this passive stretch, I am not doing it actively, you are doing it, okay. So this is not an active movement, this is a passive movement, I am not using my energy, okay. So see the resistance against passive stretch, that resistance is called as what? Tone. Now what happened to the tone in this upper motor neurons lesion? I have told you when the upper motor neuron is dead, the lower motor neurons are overfiring, they are doing overaction and the muscles are contracting too much. Now you tell me, whenever the muscles are contracting too much, they will offer more resistance. Okay, for the movement, they will offer more resistance. So what will happen to the tone? Automatically increases, the resistance increases. So there is going to be hypertonia. Okay. So what type of paralysis? If a patient is having a brain damage, the upper motor neuron lesion, there is going to be spastic paralysis with hyperreflexias and hypertonias. All this is because of the problem of the lower motor neuron overfiring. Okay. Now think about the lower motor neuron lesion. What will happen if a patient is having lower motor neuron lesion? See, when the lower motor neuron itself is dead, imagine here, this lower motor neuron itself dead, maybe because of polio, you know, in a patient who is having polio, it is the lower motor neurons will be affected. Or if a patient is having Brown-Séquard syndrome, that is the half of the spinal cord damage, again lower motor neuron is involved. So you tell me when the lower motor neuron is involved, do you think the muscles will contract? No, they are not going to be contracted forever. So that's going to cause paralysis again. But what type of paralysis? It's a flaccid paralysis. The muscles are not at all contracting, it's going to be a flaccid paralysis. Okay, flaccid paralysis. And what about the deep tendon reflexes? See, without lower motor neuron, without the motor neurons, do you think the reflexes are possible? No, lower motor neuron is involved in the reflexes. Without lower motor neuron, reflexes are not possible. So, there is going to be areflexias or hyporeflexias. Hyporeflexia or areflexia can be seen. What about the tone? See, the muscles are not at all contracting. All the muscles went into the relaxation, complete relaxation. There is no more contraction. So, if you check the tone, there is no tone at all. Okay, there is no resistance at all. There is going to be hypotonia. Okay, so this is what is the difference. If the brain is damaged, if there is a problem at the level of the cortex, what type of paralysis is going to be seen? Spastic paralysis with the hyperreflexes and hypertonias. If there is any damage at the level of the spinal cord, okay, spinal cord lesion, there is going to be flaccid paralysis with the hyporeflexes and hypotonias. So, just by looking at the clinical features, you can say whether the damage is in the cortex or whether the damage is in the spinal cord. Okay, just by looking at the clinical features. So, let me give you the example for a lower motor neuron lesion, polio. The condition where the lower motor neurons are affected. Okay, and anything else that you should know for your exams. See, this will again come in your medicine, but right now here I will tell you few important differences. See, fasciculations are only seen with the lower motor neuron lesions. Fasciculations are like those involuntary muscle contractions, like twitchings. So, they are called as fasciculations. Fasciculations, if they ask you, always seen with the lower motor neuron lesions, but not with the upper motor neuron lesions. And what about the Babinski sign? See, when you take a sharp object and when you strike on the foot, when you strike it on the foot, actually the fingers will flex. The fingers has to flex. That is normal. Okay, that is normal. The flexing of fingers is normal. But when you are giving this strike, whenever you strike on the sole, when the fingers extend, especially the thumb, okay, the thumb, whenever it's extending back, when the fingers are extending back, that is called as a positive Babinski sign. Okay, positive Babinski sign. So, Babinski sign is only seen with the positive Babinski sign is seen with the upper motor neuron lesions, means upgoing fingers. If the fingers go up, it's the upper motor neuron lesion. Okay, so Babinski sign is positive with the upper motor neuron lesion, and fasciculations are positive with the lower motor neuron lesion. And I have told you how the muscles will be, whether they will be too much contracted or not contracted. Either there is going to be spastic type of paralysis or flaccid type of paralysis, opposite. Okay, so these are the important differences between the upper motor neuron and lower motor neuron lesions. In first year, what you should know, upper motor neurons arises from the cortex and lower motor neurons arises from the spinal cord. Okay, so with this, upper motor neuron and the lower motor neuron lesions topic is completed. Hope the video is helpful. Thank you.